I will like to call Dr. Dhanashree Mahajan ma'am for the floral welcome of our guest speaker, Dr. Priya Sauma.
Ma'am, look, smile. Wait, one more, smile. Thank you.
Let me take this time to introduce our guest speaker, Dr. Priya Sauma ma'am to you all. She is MBBS, MS OBGY. She is a director at Neobliss Fetal Center, Ramdaspet, Nagpur. She is trained under Dr. Pratima Radhakrishnan at Bangalore Fetal Medicine Center, Bangalore. Member of Society of Fetal Medicine, Maharashtra. Attached consultant at Omega and Icon Hospital. She is certified at Advanced Ultrasound and Investigating for Chikitsa Ultrasound Training Center at in Mumbai. With that, I would also like to introduce you to our chairman of the day, Dr. Kunda Sania. She is Fellowship Fetal Medicine from Medical College, VS Medical College, Ahmedabad, Gujarat. FMF certified PG MS OBGY, director and consultant at My Lower Fetal Medicine Center, Dantoli, Nagpur. Practicing in Nagpur as a fetal medicine consultant since 9 years. Special interest is fetal therapy, genetics, and fetal ultrasound. Member of Society of Fetal Medicine India and founder of Member of Society of Fetal Medicine Maharashtra.
First of all, a very good morning. I am Dr. Priya Savan. I am a fetal medicine expert, and first of all, I would like to thank NIMA OBGY Society for this wonderful opportunity today. The topic which has been assigned to me is screening for chromosomal abnormalities in first and second trimester. So the scope of my talk will be biochemical screening for chromosomal abnormalities, ultrasound screening, and screening for chromosomal abnormalities in twins. So why are we so worried about the aneuploidies, and why in particular Down syndrome? So looking at the incidences, the incidence of Down syndrome is much more than other aneuploidies, that is 1 in 700. Also, only 33% of the Down syndrome babies show major abnormalities, and the quality of life, these babies have quality of life issues and a long lifespan, where other trisomies like 13, 18, triploidy will show major anomalies in 90 to 95% of the babies. So coming to the screening of aneuploidies, ultrasound screening and biochemical screening. Coming to biochemical screening, first trimester screening, we all know we all do double marker. Double marker, when combined with nuchal translucency or NT scan, has a detection rate of approximately 90%. There is something called as first trimester quadruple marker, which is being done in a few centers, which gives us an extra information about the placental growth factor, which is very important predictor of preeclampsia, and alpha fetoprotein. So extended first trimester screening gives us an earlier and an extra information of alpha fetoprotein. NIPT can be done anytime from 10 weeks onwards. Chorionic villus sampling for the first trimester. In second trimester, we do second trimester quadruple test, genetic sonogram. I'll come about the genetic sonogram later. NIPT and amniocentesis for diagnosis of chromosomal abnormalities. Triple marker should not be done. It is obsolete and because it has very low detection rates for aneuploidies. Now, the question arises, how should we screen twins? Whether to do NIPT, whether to do double marker, whether to do a quadruple test. So, a combined screening that is NT along with double marker has the best detection rate, has a better detection rate for twins. Quadruple test should not be done in twins. NIPT can be offered. So, the most practical screening test in first trimester is combined test for both NCDA and DCDA twins. Quadruple test should not be done as it performs poorly. NIPT can be offered. So, aneuploidy screening in twins, in case of a DCDA twin, we have two risk numbers when we do a combined test, and in monochorionic twins we have single risk number. For in second trimester screening for twins, we should only look for soft markers and do a good genetic sonogram or anomaly scan. So these are the ultrasounds available. These are the scans available for us. But in order to screen for chromosomal abnormalities, NT scan and anomaly scan are a way to work. Coming to the first trimester screening, the protocol should be a pre-test counseling is a must. Informing the patient regarding the risk, the result, the way the results are going to come, what kind of risk numbers are going to come. An NT scan should be done from 11 weeks to 13 weeks, 6 days with CRL of 45, that is 4.5 centimeters to 8.4 centimeters, along with serum biochemistry to be done from 11 weeks to 13 weeks, 6 days. NT scan is a window of opportunity. Apart from doing the biochemistry, apart from doing a generalized survey of the baby, that is the CRL, FHR, or confirming the gestational age, a system-wise assessment of the baby should be done. So this is a picture of a CRL. The baby measures approximately 7.4 centimeters or 74 mm of CRL, and that's the picture of an NT, a mid-sagittal view where we can see the nasal bone of the baby. That's the rectangular palate of the baby. That's the chin of the baby, and here is the NT of the baby. That's the intracranial translucency or the fourth ventricle. What are the requirements or the prerequisites to have a good NT is the section should be mid-sagittal. The section, it should be magnified in such a way that the head of the baby and the upper thorax should be filling the screen. So anything less than that is suboptimal. Since the phenotype is normal and there were short long bones, which is quite likely to be lethal, quite likely to be associated with skeletal dysplasia. With the stored DNA, we did FGFR3 gene mutation testing, which came out to be positive. So that's the material. PCR and genotyping. If there is some genetic problem, a sender sequencing, a microarray, if there are multiple problems. When the index child has unexplained learning difficulties, or antenatally we see there are multiple problems in learning, there is dysmorphism, developmental delay, multiple consonantal abnormalities. Now, what is the role of next generation sequencing, that is whole exome and whole genome sequencing? So, what is NIPT? What is the role of NIPT? There is some amount of circulating cell-free DNA, cell-free fetal DNA in the mother. So that DNA is extracted and ships mother for invasive testing and increase risk on combined or triple test or quadruple test. The contraindication will be triplet pregnancy, fetal anomalies or on ultrasound, invasive testing.
Good morning, everyone. First of all, I want to summarize. I want to tell that first trimester scan is very important, and when it is combined with the fertility test with the help of chorion, venous biopsy or amniocentesis to give the informed choices to the couple that we are continuing this pregnancy or markers that we evaluate as these are called as a soft markers because they can be present in normal fetus also.
Thank you so much. That first and second trimesters. Any question and answers?
Associated with structural abnormalities, in particular cardiac. So it's where you are more prone to cardiac abnormalities. So you should do a good screening, ultrasound screening.
Best thing to do for the fetal POCs, early pregnancy. Microarray is to be known.
Thank you.
And that to be, we try to collect the sample with a sterile bed. Okay, so most of the time karyotype is not advisable because it is
the innovator and guardian certificate, I would like to call upon stage Dr. Kamini Thiman.
Mike. Wait, one more. Thank you. One more smile. Thank you. Smile. Wait, one more smile. Thank you. Your keys.
NAGPUR. It is our international lecture and it is very on demanding subject. As we know, the research in any field plays an important role, and research in medical field leads to the significant discoveries, improves healthcare, and ensure that patient receive the best care possible. It is what makes the development of new medicine treatment possible, and without it, we would not be able to move forward in the development of medicine. As a scholar, Sir has done a master in surgery in human assisted reproductive technology and embryology from Spain University of Valencia. Sir is a consultant in infertility and eugenetics. Sir has received many awards. That is the International Award from Rotary Club. Sir has got a Gem of Medicine award. Sir has presented the role of Ayurveda in infertility National Conference on Vandatva, which is held in the Goa. Sir has given many interviews in Daily Lokmat, Daily. So I would like to introduce our guest speaker. Ma'am is an applied biopharma and healthcare professional who, while working with global pharmaceutical companies, and has been involved with vaccine research and development. Ma'am will talking about the first area of integrative research in OBGYN with special focus on maternal and infant immunization.
I would like to give you a brief history of vaccines and vaccine development, pathogens of concern for OBGY, have a look at the future, including areas of advancement and areas of interest for research. And finally, how these all feed into maternal and infant immunization. We will look at the benefits and challenges of vaccination and what can be done to improve uptake. The number of cases of individual diseases before the use of vaccines early in the 20th century, and the number of cases currently, where of course we see a tremendous drop. This effect is probably more important than any other medical intervention. So this slide shows one of the two general strategies for developing vaccines in the past, and that is attenuation. The first, of course, was Jenner's vaccinia. But then, Louis Pasteur, around 80 years later, started to physically attenuate agents such as rabies. And that really gave us the first general vaccines that could be given by injection. Then, in the 20th century, passage of agents in animals or in eggs, as in the case of the yellow fever, gave us more vaccines. The other strategy, of course, was inactivation. That began at the end of the 19th century when scientists in Europe inactivated typhoid bacilli, cholera bacilli, etc., and continued into the 20th century with inactivation of pertussis, and of course, later on, polio, hepatitis, and others. Also, in the 20th century, inactivation of bacterial toxin was used to develop toxoid vaccines such as diphtheria and tetanus. And then, moving on in the 20th century, it was realized that bacterial polysaccharides could be used as vaccines. For example, meningococcal polysaccharides, but they were not very immunogenic in children. The discovery of protein conjugation polysaccharide allowed us to use that develop protein vaccines against meningococci and other bacteria. This slide shows the seroconversion rate. 2 weeks after administration of DNA, 100% of the vaccinees developed antibodies, the viral DNA, through the upper layers of the skin. So in some circumstances, that may not be practical. But then given intramuscular administration as like other vaccines. Acid strategies that could give us vaccines in the future, not only for potent vaccines, but vaccines that can be rapidly developed once you have a sequence of pathogen. Obviously, this is being applied to emerging disease. I would like to say a word about bacterial vaccines, and I stress that they are more important than ever, which has proven useful in determining which antigens of bacteria can be vaccine antigens. Basically, what reverse vaccinology is, as shown on the slide, a quick way of identifying which proteins you should follow on as possible vaccines. So this technique has been used, for example, for many vaccines, but it could also be used for more common bacteria such as E. coli or Pseudomonas. We need this because, as I mentioned before, infections from becoming manifest and therefore reduce the need for antibiotics. I'm not going to go into detail about the mechanism on which adjuvants used to do that. Pathogen recognition receptors, PROs, that are present in all of us and in animals as well. Depending on which receptor you want to stimulate, different adjuvants have been developed. So I think there's no question that these are going to be important. Have much greater responses than a single adjuvant that is stimulating virus neutralization. So that is something to keep in mind for the future, where it's possible for these new adjuvants to be used in vaccines development. Is to choose the right antigens. In addition, we need to solve the problem of immunizing infants when their immune system are still immature, and also the elderly. Different adjuvants will be useful. So, in general, even though development of vaccines has become more complicated because the targets are more difficult and more complex, we are developing ways to deal with these complexities. Pregnancy is a particular susceptible period for maternal and furthermore, such illnesses are also associated with adverse pregnancy outcomes, such as spontaneous abortion, congenital abnormalities, preterm birth, and low birth weight. In addition to direct immunization. The concept is able to mount an effective immune response to immunization. Infants born to mothers with low levels of pathogen-specific antibodies have low levels of antibodies, which may not be sufficient to protect against disease. As these maternal antibody levels wane following birth, these maternal antibody levels also wane at the same rate, but because the starting point was higher, the period of time where the infant has antibody levels below the protective threshold is reduced. Therefore, we will now look at the benefits of maternal immunization in relation to the specific pathogens we discussed earlier. Numerous studies have been conducted to explore the safety of routine and pandemic influenza vaccination of pregnant women. Is most pronounced during the influenza season, that is to say, when the virus is actively circulating. It also suggested that prevention of influenza infections in pregnancy can influence intrauterine growth. Included in local recommendations to facilitate discussions between healthcare providers and patients. Keeping it simple, using language that resonates with mothers, has had significant uptake in vaccination, used a multi-channel approach consisting of community awareness, pharmacy programs, and GP incentives, resulting in the of maternal vaccination programs, and there is an increased data regarding the safety and effectiveness. However, better understanding is still required. Maternal vaccination provides a new platform for preventing significant and setting the future of maternal immunization is bright. One more thing I want to include a valuable asset in alleviating human suffering. I will be in touch with my old friend Dr. Archana Jumle and many other friends that I hopefully have made today and explore more about Ayurveda. Thank you very much, the NIMA OBGY Society Central and Tata Megi Ayurvedic Medical College, Hospital and Research Center for inviting me to be part of this conference. I congratulate you on this magnificent conference and I wish you all the luck for the future. Keep up the great work, guys. For questions, kindly coordinate with Dr. Archana and I will try my best to answer them if there is. Thank you all so very much.
Okay. Thank you very much, ma'am. Really, it was a very informative, knowledgeable presentation on infants and maternal immunization. Ma'am efficiently elaborated the topic. Thank you very much, ma'am, and we look forward in future for such a presentation.
Updating us all regarding recent developments in vaccinology. The gist of the presentation was maternal and child immunologists as well as medical experts. So regarding maternal and child health, we have heard telling us about vaccines, importance of vaccines to maternal in the maternal case, so that the child and mother come out years. It has gained a reduction of only 5 points in the score. So it is a very big challenge for us to reduce child mortality rate as well as maternal mortality rate. So when it comes to immunology, I think the best solution is lies with IVANA only. We are trying to give importance to maternal immunization so that the baby is also healthy. When we look back in Ayurveda, we find that Garbhadhan Sanskar, it starts from Garbhadhan Sanskar. Then it comes to antenatal care, Garbhini Paricharya, then Sutika Paricharya. So while talking about all these Paricharyas, we must not forget about epigenetic changes that are taking place due to environmental factors.
Look, smile. Thank you. Yes, Lydia. Smile, please. Good. One more smile. Thank you. Thank you, sir. Smile. Great. One more smile. Thank you.
Now I will request Dr. Rajesh Uttade sir, please felicitate our international guest speaker. On behalf of Dr. Claire McCrudden,
Look, sir. Smile.
I am very much thankful and appreciate our international guest speaker, Dr. Claire McCrudden, for their valuable inputs, valuable knowledge to sharing with
Look
us
here.
on behalf
Smile.
of NIMA
Ma'am, this way.
OBGY Society Central and Datta Mege Advent Medical College Hospital Research Center, Nagpur.
One more smile. Great. Smile, please.
I'm also
This way, look. Smile. Wait, one more. Thank you.
With blessings of Lord Dhanvantari, I, Dr. Priya Rao, extend my warm hearty welcome to you on this third session of Third Day International Conference, Social Peace 2023, organized by NIMA OBGY in collaboration with Datta Mele Ayurvedic College Hospital and Research Center. Topic for third session is male infertility. Male infertility can be caused by low sperm production. Now it's time to call our chairperson, Dr. Manoj Gaikwad sir, on stage. Sir, please come on stage. Dr. Manoj Gaikwad sir.
This way. Smile. Wait, one more. Thank you.
Thank you so much, ma'am. Vocational qualification BMS MS in Prasuti Tantra, as well as he did his PhD in 2008. He has guided many PG and PhD students in the field of Prasuti Tantra. He has great research work and has many.
Ma'am. Thank you.
Dr. Prashant Garg, he has more than 20 years of teaching experience in the field of Prasuti Tantra. She is a research scholar in Department of Biotechnology, LPU, India. Her research area is endometrial receptivity.
Infertility incidents are increasing. Solely male infertility among infertile couple is 20 to 30%, and further contribution of the men is 20% between the year 1971 to 2011. So here it is what was it told in the previous slide, that 15% of the all couple are infertile and 1 out of 7 are infertile. Here male factor, female factor is 50%, combined factor is 20%, and male factor is 30%. First and the foremost investigation for the partner. So this is the cornerstone of the evaluation history taking. First, when the patient comes to the doctor has to take the history, and that history should be under the 8 headings. One is medical history, one is surgical history, fertility history, family history, occupational history, medication history, sexual history, and social history. And out of all, you can write down all the eight like parameters that we have to find out, that whether when the patient has come, that the patient is suffering from fever, or there was any history of surgical trauma, or any hernia surgery has been done, or any genetic disease has been diagnosed to the patient. If there is any fertility issues, like the patient is with the first time marriage or the second time marriage, whether the patient is having the baby from the first marriage or something like that, and whether there is a genetic history of the family history like cryptorchidism, hypospadias, that lung and midline defect that runs in the family. If there is anything present, then you should note it down. From where the patient is coming, what is the occupation of that patient, what is the medication he is taking, whether some kidney problem that or whether the patient is on some alpha blocker, or whether some chronic hypertension or something like that is there. What is the frequency of the sexual relation they do?
I'm honored and blessed to announce that we have our honorable chief guest, Shri Dattaji Mele over here.
दत्ताजी मुंगे साहेब आले होते नागपूर मुंबई होणार आले
I request Radha to please come on the dais for Dhanvantari's Kavan.
Namo
2023 Boom and Boom Saga.
Myself, Dr. Priya Savle.
And myself, Dr. Arpita Shah. We are very happy to receive all of you here in Orange City, Nagpur for Sushruti 2023.
Sushruti is a first ever conference jointly organized by NIMA OBGY Society and Datta Megi Ayurved Medical College, Hospital and Research Center, Nagpur.
We, NIMA OBGY Society, believes that talent wins the game, but teamwork and intelligence win the championship. We possess the purpose of uplifting the existing and upcoming OBGY professionals by every means, and it has been appreciated by the Datta Ayurved Medical College, Hospital and Research Center.
For Sushruti 2023. Welcome ma'am, welcome all.
Honorable guests, we are delighted with all of your presence on the dais. Moving to the next, I request Dr. Doral Zuke. Sir, we are blessed with your presence here, sir.
Ma'am, look, this side, smile. Thank you.
Now, I request Dr. Suhas Herlikar sir to please felicitate Dr. Meenu Bhalot ma'am.
Thank you.
I would like to call upon this to felicitate Dr. Sao sir.
Ma'am, let go. Ma'am, look. Ajay.
2 minutes, yeah.
Yes, smile. Thank you. Sir, look, smile. Thank you. Sir, look this side. Smile.
I request Dr. Agrawal sir to please
Wait,
come on dais.
one more smile. Sir. आ जाए दो
फोटो काट दो
हाँ यस रेडी स्माइल देखिए वेट वन मोर थैंक यू सर दिस साइड स्माइल फोटो ಹೆಂಗೆ ಬರುತ್ತೆ
वीडियो काढतो
थैंक यू and this side smile thank you one more smile wait one more thank you wait one more smile thank you wait one more thank you
I request
sir this side smile thank you sir look smile wait look here smile wait one more thank you
now I would like to request Dr. Sheetal Kende ma'am to felicitate Dr. Harsh.
yes look smile okay ready yes smile please look here ma'am thank you
Yes.
thank you Smile. Thank you. Smile. Great. One more. Thank you.
पद्मश्री मनोरंजन साहू सर, मैडम हर्षला, जिनका हमेशा हमें सपोर्ट रहा है, जिन्होंने खुद सपोर्ट दिया है हमें इस प्रोग्राम करने के लिए, आशुतोष कुलकर्णी सर, टेक्निकल सर, विनायक मित्र सर, बाकी सभी जो स्टेज पर उपस्थित हैं, all the dignitaries on the dais, off the dais, faculties from all over India, scholars, PG scholars, UG scholars present in the hall. We from NIMA OBGY are over here to welcome all of you and to share knowledge with all of you and to support all of you. First of all, I would like to introduce to all of the dais, I think to new generation, what is NIMA? NIMA is a largest association of India. WHO and UNICEF also recognize that it is the largest association which works for the patients, for the doctors, for the community. Always support to the graduates of recognized colleges of the CCII who have done studies from the recognized universities or we can say colleges by CCII. When you do your studies, you complete your studies, you always think about your future.
मैं शुरू में आपकी माफी मांगना चाहता हूँ कि मेरी तबीयत ठीक नहीं थी, 37 साल का एज है, इसलिए मैं बैठ से आपसे बात करूँगा। हमारे स्टेज पे बैठे हुए सर्व सम्मानीय अतिथिगण, डॉक्टर लोग और एक जो सम्मेलन हो रहा उसमें आए हुए सभी भाई और बहनों, NIMA OBGY Society of Dantanagar Ayurvedic Medical College हॉस्पिटल एंड रिसर्च सेंटर नागपुर के सहयोग से यह अंतर्राष्ट्रीय परिषद आयोजित की गई है। इस कॉन्फ्रेंस के लिए देश के विभिन्न राज्यों से वैज्ञ और आए हुए हैं। पीजी लोगों के लिए कार्यशाला का आयोजन किया गया। इस अंतर्राष्ट्रीय परिषद का बहुत महत्वपूर्ण रहा है क्योंकि इसमें अभ्यासक्रम के लिए गए शल्य कर्मों का तेज प्रसारण किया गया। आयुर्वेदिक ही प्रसूति तंत्र जीर्णतंत्र में शल्य कर्म के सभी 100 साल पहले के आयुर्वेद कार्य श्रुति जी ने लगभग 300 सर्जरी का शोध लगाया था।
Sir, lips, smile. Great. One more smile. Thank you.
सरांचा फोटो काढ. सर आले मग पलीकडे. सर आलेत ना पलीकडे. त्यांचा फोटो काढायचा.
This August gathering. Indeed, it's a great pleasure for me to be here as a part of this program organized by the NIMA OBGY International Conference over here. Most respected Sri Dr. Nagaji, who has just left, renowned academician. Today's chief guest, Madam Minu Bhanorji, the organizing committee, Madam over here, Kamini ji, the dignitaries, Dr. Sita ji, many other dignitaries to whom I personally I know that it is difficult to name all of them. Along with me, I have two colleagues, Dr. C.P. Gupta and Dr. Raman Singh, who is from Varanasi. Participants, my young students, residents, ladies and gentlemen, to be very honestly speaking, I'm not usually do not usually be a part of this Gynae association over here, but really it is Dr. Kulkarni ji who asked me to be here and to say something, so I could not deny him to be here. Otherwise, I'm really a very beginner or learner in this process.
From in our academic career, and which is going from so long. We have heard everything, the science what they have inside the Vedas. We are learning from that. As the Dr. Manmohan Sir had already explained, whatever we have learned with the persons who have made the landmark in our academics, we are taking the inspirations from them. We want to come with this present changes that we want, and we want to give our the good future to our students, to the beginners, the budding gynacs in our faculty. This is what the society is about. Moving forward together, their success takes care of itself. The collective work from all over area of the country, every state can take this vision in lead. And this is the main motto of society. If you are working something exciting that you're ready to take care about it and having the keen interest in that, and you follow it as your passion and not your profession, then you don't have to be pushed for that. The vision pulled you consistently in that direction. Dear all, the NIMA OBGY is not just an organization.
Magaya.
म्हणजे आपण काम करा हे 5 पॅटर्न जे सीचे आहेत ते त्यांना आवडले आणि त्यानंतर रात्री मला फोन आले की सर आपण काय करूया आपण एक संस्था स्थापन करू ओबीजीवायची संस्था स्थापन करू त्यांना सांगितलं तर हरकत नाही आपण कधी करायला हरकत तुम्ही प्रयत्न केलेला आहे पण आपण सुरू करू आणि त्या पद्धतीनं त्याच दिवशी ह्या संस्थेचं कन्सेप्शन झालं आणि हळूहळू ही संस्था वाढायला लागली. वाढत असताना बरेच मध्ये ऑब्स्ट्रक्शन आली. प्रिया असतील, कुलकर्णी सर असतील, सारखी वॉमिटिंग व्हायची, सारखे नॉसिया असायचा. हा नॉसिया वॉमिटिंग बाजूला करत 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 आम्ही 3rd ट्रायमेस्टरमध्ये पोहोचलो. 9व्या महिन्यात पोहोचल्यानंतर सुजितचा मला फोन आला की सर पोस्टपोन करायचे का, कारण काही प्रॉब्लेम्स आहेत. म्हणलं डिलिव्हरी कधी पोस्टपोन करता येत नाही, अदरवाईज बिकॉज मी डेड. म्हणून कुलकर्णी सरांनी एक फंडल प्रेशर दिला आणि आमचं सुश्रुती नावाचं हे बेबी डिलिव्हर झालं. आणि बघा यालाच आम्ही सुश्रुती नाव दिलं कारण आम्हाला इथे स्त्रियांचा मान राखायचा आहे. सुश्रुती नावाचं फिमेल बेबी त्या ठिकाणी डिलिव्हर झालं आणि तेच आज आपल्यासमोर आहे. वास्तव काय नव्हत्या म्हणून मी पुणे आयुर्वेद गायनेक सोसायटी नावाची सोसायटी काढली. म्हणून ट्रायकोड होते सेक्रेटरी. मला त्यांनी प्रेसिडेंट टाळायला केलं. म्हणजे प्रेसिडेंट मला व्हायचं की कारण नाही आपण संस्था स्थापन करू. त्यानंतर आम्ही 3 वर्ष ही संस्था चालवली. दर महिन्याला आम्ही लेक्चर्स घेत होतो. एक आठवडी कॉलेज बरोबर आम्ही सुरक्षित मातृत्व आयुर्वेदाचे योगदान या नावाखाली कॉन्फरन्स घेतली आणि 100 डेलिगेट्स त्यावर आले होते आणि आमची कॉन्फरन्स सुंदर झाली.
Just the techniques. If we know the subject, we can do it. But sometimes we have to depend upon the other just because the laws. And I request ma'am, even we were discussing here that we should be doing something for the development of our future generation, the PGs, and we need more research scholars. Everybody is doing the practice, but now the old practitioners should guide their students to have the paper, and that should be published in good scopus in that journal, so that the society should come forward and they should understand that Ayurveda is not only that we are just dependent on them. We are not dependent on them. We can lead from there in front and they can follow us and they would follow us. But need is the time of the hour is to we have to do work and we should do work, and I am doing a really good work and all the senior doctors here are doing some. I would appreciate the work done over here, and I also need that if I would say that if after every successful man there is a woman, I would say every successful woman there is a man, and my man is with me and he is always forcing me to do this. I would say no, I will not doing PhD. He would say no, you have to do. You will not, who will do? So I thank you him, and on this stage I really want to thank Vishal for supporting me for his love and his belief in me. Thank you. Thank you.
Ma'am, we are honored to have you here on stage.
Look, smile. Wait, one more. Thank you.
Here.
Ma'am is a founder, life member and member of Governing Council of Ayurveda Section Mandal, Pune since 2010.
I'm very happy to say all these things because yesterday my minimum 30 to 40 past students met me during. So I'm really very happy to see all these students which are progressing day by day, and I was working in Ashtangaved Mahavidyalaya and Rudralaya for last 140 years, as well as my mother, Dr. Taravi Himay. She was her Prasuti Griha. There also I was working for 40 years. And my husband, Dr. Amish Padanspe, who persuaded me to do MD, because first I was BA in NS in 1970. After that, after a big gap of 40 years, I had done MD at Suritantra, and because of that, my husband is mainly MD-based MD gynae, and after that he has done Ayurvedic practices, and because of these all two paths, I could know about the limits of both the paths, and that is the main thing about my husband.
There's a correction. Ma'am has guided more than 50 PG students till date, and ma'am has been awarded by Anandibai Joshi Puraskar too.
Look here, smile. Great, one more smile. Thank you.
NIMA OBGY Central and State Body for considering me and for appreciating me. And second, this lifetime achievement, actually my lifetime achievement is my house students, my juniors in because of them I am here. So, thank you.
I really feel happy and blessed to release this book on this dais. We are honored to have our delegates over here.
और सोसाइटी बनके जो हमारे पोस्ट ग्रेजुएट के प्रॉब्लम सॉल्व करना, उनका नॉलेज अपडेट करना, नॉलेज शेयरिंग प्लेटफॉर्म उन्हें देना, उसके लिए ये सोसाइटी फॉर्मेशन हम लोगों ने की है। और उसकी एक कड़ी जो है ये नीमा OBGY सोसाइटी। जितनी भी आज तक हमारी सोसाइटी खुली है, फॉर एग्जाम्पल नीमा प्रोटोलॉजी सोसाइटी, नीमा पेडियाट्रिक सोसाइटी, देन इसी प्लेटफॉर्म पे नीमा OBGY सोसाइटी जब से फॉर्म हुई है, फ्रॉम वेरी फर्स्ट डे टू टिल दिस डे, उनकी जर्नी कैसी हुई है ये 101% मैं अच्छी तरह से जानता हूँ। कितने ऑब्स्टेकल उसमें आए हैं ये भी जानता हूँ, लेकिन ये जो नीमा OBGY का डॉक्टर अर्पिता शाह, डॉक्टर सुनील शिंदे, डॉक्टर अर्चना जुमड़े, डॉक्टर अजय बाग, राहुल कांबड़े, मनीषा देवकाते, प्रतीक्षा राठौड़, प्रिया चावड़े, श्वेता महाजन, धनश्री महाजन, उमेश लुनावत, डॉक्टर मिसेस भोसले, ये टीम ने इतनी मेहनत करके इतनी मेहनत की है कि पूरी तरह से मैं अच्छी तरह से जानता हूँ। और उसी मेहनत से आज इतना बड़ा जो आज नेशनल लेवल पे नीमा की तरफ से लाइव सर्जरी वर्कशॉप जो यहाँ परफॉर्म किया है, और सही में प्लेटिनम जुबली ईयर में OBGY सोसाइटी ने नीमा को दी हुई एक गिफ्ट है।
Smile. Wait. Thank you. Thank you. Wait, one more. Thank you.
Thank you, sir. The practice of gynec and obstetrics from the prestigious institute. It's a privilege for me to get an invitation from NIMA OBGY to present a topic related to Ayurvedic management protocols in ovulation induction. So I sincerely thank for the invitation, and I'm just going into my topic. So standing here, I am an Ayurvedic postgraduate in Prasuti Sriroga. From Kerala, and our strength is purely an Ayurvedic management in gynecology. So my presentation will be focusing on that aspect. So beginning into my topic, this important verse in Yoni Vyapar makes me think a lot. So during my postgraduate days or any undergraduate students, just read these verses and just forget. So I'll be discussing in the coming slides. Nahi Vadavade Yoni Validanam Pradushyati. What is more fascinating about Vayu? What is more fascinating about identifying Vayu, managing Vayu? You know, there is only one chapter, one doshas which is being dedicated a separate chapter for its management called Vadavyadi Chikitsa.
बैटरी चार्जिंग लगा क्लिक करूँ तक
Yes.
Yes, sir. I wait.
Thank you, sir. You are clear that today's session is concluded. Now I hand over the mic to Dr. Pratiksha Rathod. Thank you.
Small announcement regarding one conference which is going to held in Burma. So
So it is international conference on recent advances in Panchagavya researches and innovations called Panchagavya 2023 on date 11th and 12th March 2023. This is going to held in Mahatma Gandhi Ayurvedic College Hospital and Research Center, Varna. And can I have the registration page? These are the registration details. This is a request to register for the same. If there is any query,
remove mic. Thank you. Secchi smile. Look here. Thank you.
Medical College Hospital Research Center and
Dr. Prashant Mishra Umate, Assistant Professor, Department of Dravigna, DMHRC,
shall be walking you through the fifth session of the lecture series. Let me call on the stage our respected chairman, Dr. Soni Kapil ma'am, on the dais. Ma'am, please come on the dais. I request Dr. Archana ma'am for floral welcome of our chairperson, Dr. Vishnu Bhavane sir.
India, mic. And this side, mic.
I request Dr. Pratiksha Rathod ma'am for floral welcome of our guest speaker, Dr. Jasmine.
Mic. Wait, one more. Thank you.
theoretical or the classical references, I will only highlight on what advances are needed and updates are needed in the current scenario where we want to reach globally with our treatment. So if we see the classical Ayurveda therapies, local therapies, we won't be able to reach the global market. So that is why, yes, as sir also said in the previous session, how important the sugar and shaman chikitsa becomes in Ayurveda gynecology practice, and hence one more important tool is the sthanic chikitsa, which we all should implement in our routine general practice also. These are the indications where we commonly use the local gynecological procedures, very commonly in vaginitis, cervicitis, erosion cases, dryness, incontinence of urine, genital polyps. Even in these conditions, when the modern medicine fails, they refer the patient to us that we are no longer able to do anything in such conditions. Please, if anything can be done from your science, please do that. Genital polyps, dyspareunia, even in vaginal rejuvenation. Nowadays, new thoughts are coming, and there are so many therapies where they perform vaginal rejuvenation, and not only not in India but in outside they have done a great work in the vaginal rejuvenation therapies. We see that menstrual abnormalities, even when Shodhan and Shaman is not good enough, we also shift to the sthanic chikitsa. Infertility, menstrual abnormalities, fibroids, and even very basic concept is the defense system. We know that the pH should be maintained to maintain the vaginal microbiota, which is very important in infertility also and preventing the vaginal infections also. And we know that who is responsible, estrogen, glycogen, and as well as the bacilli, that the dordaline bacilli is responsible to maintain the vaginal pH acidic. These are the causes of the change in the vaginal pH. I want to highlight antibiotic therapies and stress. Despite of the getting dead, and that is why the vaginal defense is being destroyed. Another cause is stress, which is very common in a working female or a housewife. Everywhere the stress will be present. And the reason stress changes the vaginal pH is the corticosteroids. It again destroys the lactobacilli and hence the pH is changed. Third I want to highlight is the STDs. Use of non-barrier method of contraceptives have led to the increase in the sexual transmitted infections. And this also, if repeated infections are happening, it changes the vaginal pH. And the cases have been reported that repeated vaginal bacterial vaginosis also lead to the development of cervical cancer. And again this have been highlighted.
Chikitsa is a move to our therapeutic measures for the gynecological problems. But some procedures are little bit cumbersome. These are not patient friendly. Now we have to work on that how we make our treatments patient friendly. And nowadays the science has evolved a lot. As we put quartz in vagina, they usually come out instantly. So we need some kind of delivery system. So nowadays bioadhesive medicines, as madam has told, and
medicine is developing day by day.
And we are getting very good results. But problem arises the patient compliance. By advising the patient to do these procedures by own. So it is better to call the patient to the hospital for the same. Or you have to go for some other alternatives by taking the help of other technologies.
I request Dr. Sheetal Inde ma'am to felicitate Dr. Soni Kapil ma'am.
Smile. Yes, ma'am.
I request
इकडे ma'am. Yes, thank you. Smile. Okay, done. Thank you. One more, sir. Smile. Yes, thank you. Smile.
Dignitaries and delegates present for today's session. Finally, we are moving to the last session of our International Conference Sushruti 2023, the valedictory function. After the feast of 3 days, which was full of knowledge and enjoyment, that included live surgeries, guest lectures and cultural events, it's time to conclude this international conference. Let me first acknowledge the presence of our some eminent guests. It is indeed a pleasure to have amongst us Chief Guest of Valedictory Function, respected Dr. Sadhana Kulkarni Madam, President NIMA Women's Forum Central Council, our special guest Dr. Sheetal Inde Madam, NIMA Women's Forum Nagpur, Secretary, Dr. Suhas Helekar Sir, President Maharashtra NIMA OBGY Society, my sincere apology. I request Dr. Bhageshi Khote Madam, our evidence observer, to please come on the dais.
Smile. Sir, इकडे. Smile. Yes, thank you. Yes.
मैं अकेला ही चला था जानिब, मैं अकेला ही चला था जानिब, मंजिल मगर लोग साथ आते गए और कारवा बनता गया. Namaste and good evening to all. It gives me a great pleasure to address you all today as we come at the end of the India's first international NIMA OBGY Central Conference, Sushruti. It has been a privilege to witness the exchange of knowledge, ideas, practice that have taken place over the last few days. This conference was a celebration of ancient wisdom and knowledge of Ayurveda, and how it can be applied in the modern world. The theme of the conference, the and saga, has brought together experts, researchers and practitioners from all over the India to share their knowledge, practice and insights, learning in the field of Ayurveda. On the first day of the conference, we reflect on the various innovative paper presentations and workshops by the experts on instrumental delivery, page drill, etc. On the second day, for the first time in India, we witnessed the live surgical workshop where we witnessed the different types of surgeries and the procedures from the experts. And then the NIMA OBGY quiz competition where we found a lot of young talent. On the evening, we enjoyed a cultural event. On third day, we attended the keynote lectures by the experts by Priya Sahu, Dr. Claire, Dr. P. Pradeep Kumar, Dr. Neeta Masekar, and Dr. Jasmine Gujarati. The workshop, discussion, and expert lectures, and the live surgical that took place, one thing stand out: the immense potential of Ayurveda to transform the world of healthcare. Ayurveda offers a holistic and integrative approach to health and well-being, one that is based on the principles of balance, harmony, and self-awareness. The discussion that took place during the conference reinforced the importance of Ayurveda in the current healthcare landscape. We are all aware of the growing burden of infertility, obesity, increased need of IVF, chronic diseases, mental health issues, lifestyle disorders, and how they affect the quality of life of individual and community. Ayurveda has the potential to offer effective solution to these challenges by providing personalized and natural approach to healthcare that address the root cause of the disease. As an organizing chairman of Sushruti, Secretary of Maharashtra NIMA OBGY, and the Director of Matruveda, I would like to take this opportunity to express my gratitude to all the speakers, researchers, practitioners, organizers who contributed to the success of this conference. Your dedication, expertise, and passion for Ayurveda have been truly inspiring. I would also like to thank all the participants who have attended this conference. Your active participation, curiosity, and eagerness to learn have made this conference a truly memorable one. In conclusion, I would like to urge all of us to continue the work of revitalizing Ayurveda for healthier world. As someone said, जब इरादा बना लिया है ऊंची उड़ान का, जब इरादा बना लिया है ऊंची उड़ान का, फिर देखना फिजूल है कद आसमान का. Let us take the learnings and insight from this conference and apply in your study, in your practice, and in your research. Together, let us work toward the world of Ayurveda is recognized and valued for its contribution to the healthcare and well-being. Thank you. Jai Hind.
Smile,
Thank you,
sir.
sir.
Yes.
Thank you, sir.
Thank you. Sir, इकडे बघा. Yes, thank you.
ma'am.
Smile, sir. Yes,
I
thank you.
congratulate to all winners. Thank you very much. I hand over to Mike to culture.
And their parents proud with their outstanding performances in Sushruti Cultural 2023. Now it's time to announce prizes for cultural ceremony.
Thank you.
Okay.
Ma'am, इकडे बघा. Yes, thank you. सगळ्यांनी इकडे बघा. Smile. Thank you.
Thank you so much, sir.
Yes. Thank you. Smile. Thank you.
Thank you so much, sir. Congratulations.
Yes, thank you. Yes.
Here with us. I
Smile.
request Dr.
इकडे बघा please. Yes, thank you. Smile. Please smile.
Congratulations, Sakshi.
Smile. Okay. Yes. One more smile. Yes, ma'am.
Complete without my dear students, and this prize belongs to them, and I will hand over this to them, and I think they will be overjoyed by getting this prize. Thank you so much, organizers.
येस मॅम सर इकडे इकडे स्माईल सर इकडे स्माईल सर सर स्माईल स्माईल Ma'am, smile. Yes. Smile, ma'am. Thank you. Smile, sir. One more. Okay. One more. Yes, sir.
For felicitation.
Smile, sir. Ma'am, ikkada. Smile, sir. Smile, please, ma'am. Thank you. Yes, thank you. Ma'am, ikkada. Smile.
Who has worked as the best and biggest pillar for
Thank you.
Chairperson of Scientific Committee to please come on the stage. May I request Dr. Rajesh?
Thank you.
Now I would like to request Dr. Pramod Khobragade sir to please come on the stage. He has worked very sincerely in Scientific Committee. Next, I would like to request respected Dr. Mohan Raut sir, convener. Next, I would like to request Dr. Pratiksha Rathod ma'am to please come on the stage. She
Smile, ma'am.
who was standing as pillar in food committee. Sayog has worked hard in technical committee.
Thank you.
May I request Dr. Priyanka Nagade ma'am?
Yes, thank you.
Biggest support for Sushruti 2020.
Yes, ma'am. Thank you.
Sushruti 2023.
Good evening to all. Respected and learned dignitaries on dais, off the dais, all the members of NIMA OBGY Society and students, PG scholars. It's my pleasure to share my few words from this esteemed diet. First of all, I congratulate NIMA OBGY State and Central for such a successful event.
Yes, thank you. Done.
Not here I present Dr. Vignesh Pillai sir. He to all these students who had worked very selflessly for this request. I thank all my beloved students from the bottom of my heart. They have worked a lot for this conference. Thank you so much to all the students, This conference is successful only because of my all dear loved students. Thank you so much.
चलो फास्ट
शंतनु
रेडी
चलो
स्माइल
सहयोग
Apeksha also.